COVID vaccines cause turbo cancer, according to a flawed study that's going super viral online. I'm a scientist. I'm going to publicly shred the study just to prove a point. Now, the study claimed an increased risk of 6 different types of cancer after COVID vaccines compared to people who didn't get COVID vaccines. But let's take a look at their key data. This is a graph of the rates of cancer among unvaccinated people, the solid black line, and vaccinated people, the dotted line, where the x-axis is the number of days after vaccination, and the y-axis is basically total new amount of cancer. And if you just casually look at the data, it looks obvious that vaccinated people had higher rates of cancer. But there's something suspicious if you look closer. If you look at the left, when the data first starts, those two lines actually start to diverge basically immediately after vaccination. That would imply that the COVID vaccines are causing people to develop cancer within days after vaccination, and it's also then getting immediately diagnosed, which should sound very suspicious. So I checked their methods to find out if they did a good job of controlling for other important variables. They did not. In fact, they did an impressively terrible job. They only controlled for age, sex, insurance status, COVID infection, and comorbidities, which means they forgot one of the most critical variables, which is how frequently were these people seeing their doctors or getting tested. This is something called healthcare seeking bias, or sometimes surveillance bias. People who go in to get vaccines are usually more likely to see their doctor for other checkups as well. In fact, even just showing up for your vaccine appointment is an opportunity for your healthcare team to notice something that leads to a cancer diagnosis. And that's how you can get a cancer diagnosis within days after vaccination. You're seeing a healthcare provider. Of course, this paper didn't control for healthcare utilization whatsoever. Now, RFK Jr. has messed the same thing up by pointing to unadjusted data showing that children who receive more vaccines have higher rates of autism diagnoses. However, in the exact same papers that he points to, when the authors correctly control for healthcare utilization and a number of visits, they find zero association between vaccines and autism. It's the same effect. The children who received the recommended vaccines were also seeing their pediatrician more often in general, which meant more opportunities for diagnoses of autism and other health concerns. But once you adjust for that, the effect goes away. Even the study authors of this COVID vaccine paper hint that they know about this flaw. From line 89 on supplementary information file number 2, which you really have to be looking for, they say, for the surveillance issue, there may be systematic differences in health surveillance intensity between the two groups. Even the authors suspect what's really going on here. And this is the problem with, quote, doing your own research. Critically analyzing study design like this is not straightforward. This does take practice. And if you don't have the experience dissecting data and methods in this way, it's very easy to get caught up in confirmation bias while searching even through peer-reviewed studies.